You go. How about this? Can you hear me?
Yes, ma'am.
Yay! Thanks for coming today. And we are going to talk about the respiratory system. So take a deep breath. And, there is so much in the news about air quality and water quality, and we know how important that is. And if you know anybody with breathing problems like asthma or COPD, then they understand how important it is. And of course, we all know the fact that breathing is a requirement for being alive. That's just the way it works. So let's take a look at the respiratory system, which is the pathway for oxygen to come in, inspiration, breathing in the oxygen, and then breathing out the carbon monoxide, which is expiration. And you can see here in this illustration, especially with all the tags, how many parts, anatomical parts, are actually involved in the respiratory system. Of course, it starts up here with the nose and the mouth, the oral cavity, the nasal cavity, okay? Sinuses are included in this, and if you've ever had a sinus infection or even a cold where that congestion just blocks everything up, in here, you know how hard it is to breathe, to take in oxygen. But oxygen is mandatory for the cells throughout your body to function. That's their food. Okay? So this is all part of the process of bringing oxygen in and expiring or letting go carbon monoxide. Now we go in the nose, in the mouth, down the back of the throat to the trachea. But before we get to the trachea, we have the little epiglottis. Now the epiglottis is a funny word, isn't it? I like that word, epiglottis. It's a little flap. That's all it is. It's a little flap that sits over the trachea. And you know the trachea goes down and then into the bronchi, your lungs, right? But the epiglottis sits on top of the trachea right there, where there's kind of this branch off, right? You see that in the red? It's like blue and then it's red because that is the esophagus. Now, both the trachea and the esophagus come off of that back pathway, if you will, from the oral cavity and the nasal cavity. The esophagus goes to the stomach. The trachea goes to the lungs. So the epiglottis is there when food and water and drink are coming down the pike. The epiglottis closes the trachea. Don't go in here. We don't want food or drink in the lungs so that they go down the esophagus into the stomach. And if you've ever coughed because something went down the wrong pipe, now you know exactly what they're talking about, in case you didn't know that before. The wrong pipe means food or drink went down the trachea into the lungs instead of down the esophagus into the stomach. Now, this is dangerous for a lot of different reasons because when food and drink get into the lungs, into the bronchial tubes, into the lobar bronchi, because you have two bronchi, bronchus on the right, bronchus on the left. Okay. But the point is that it has nowhere to go, so it just sits there and it kind of rots. And it can cause infection. And that's a bad thing. And if you've ever heard on television, for example, that somebody died from aspirating into their lungs, that's exactly what we're talking about. Okay. So you see how starting from the nose all the way down the lungs, and then right below the lungs is the diaphragm. And the diaphragm is this kind of muscle thing that the lungs kind of sit on. And the diaphragm plays a part in helping the lungs contract to expire. And then the diaphragm moves down to allow the lungs to expand when you're bringing in oxygen. Now, as you look at all of these medical terms for all of these anatomical sites, you'll notice that there are similarities, okay? You have the different lobes of the lungs. You have the bronchi, right bronchus, left bronchus. So don't let this massive amount of words intimidate you. And the best way to do it is inch by inch by inch. Okay. Let's take a closer look now at the upper respiratory. And when referred to, the respiratory system is referred to in two parts. There's an upper respiratory system and the lower respiratory system. Okay. The upper respiratory system, and you might have heard somebody be diagnosed with an upper respiratory infection. URI, upper respiratory infection. What type of tube do you use to go through the nose to the stomach? That would be an endotracheal tube. It's a it's a plastic tube that is threaded through the nose, then down the back, past the epiglottis into the trachea. Oh, I'm sorry, into the stomach, you said. The stomach would be then down the esophagus into the stomach. And this is a way of feeding someone who may not be able to swallow because they can't eat in the normal way. So they have to feed them through, it's called a nasogastric tube. Naso, nose, gastric, stomach. Piece of cake, right? See, this medical terminology thing isn't so hard after all. Okay, a nasogastro tube. And then the nose part of the tube is attached to kind of like an IV, only IV means intravenous, so that a liquefied form of nutrition is then passed through. This is a good way to help somebody who cannot eat in the normal way because it uses a natural orifice, okay, going through your nose down into your stomach. There are no incisions, which means a greatly reduced opportunity for infection, which we don't want. Also, no cuts to heal. We like that too. Okay. All right. Does that help you? Okay, but the stomach is part of the gastrointestinal system, so I don't really want to spend too much time talking about it. But no, generally, if you're going to pump someone's stomach, which is the common phrase for that. That's done through the mouth, not the nose, because you need a bigger, and that's output, as opposed to nasogastro is input of nutrition. Pumping someone's stomach is out through the mouth because they're trying to get the stomach emptied. Okay? Did that help? A little. Okay. Well, email me if you want to know more. Or wait until we talk about I think we talked about the digestive system. I'm sorry, I can't remember. Okay, the upper respiratory system. The nose, the nasal cavities, the nasal conchae, paranasal sinuses, the internal nares, the nasopharynx, which is that back hallway, if you will, is the pharynx. So you have the nasopharynx, which is what you bring in through your nose, then travels down the pharynx. It connects. The nasopharynx is where it connects with the pharynx. Then you have the oropharynx, which is behind the mouth. And the pharynx is then what leads down to the trachea. Okay. And like I said, I had a Zoom meeting earlier or yesterday with and one of the participants, a gentleman, had a sinus infection. And oh man, he could teach this because he knows every part of his sinuses all filled with gunk, also known as mucus. Okay. All right. All right, the lower respiratory system, starting at the larynx, the trachea, which, as I said, is the tube that goes down into the lungs, and the bronchus, which is that like upside down tree. Let's take a quick look here. So we have the trachea here, the blue and white striped pipe, if you will, that then branches out into the right and the left. Bronchi, bronchus times 2, bronchi, plural. Okay. So that, oops. Okay. And that leads out to the bronchioles, which they look like little buds on a tree, on the tree branch. Okay. And then the alveoli, which is where the exciting happens. Okay. And this was in the you see here in the inset on the upper right, you have the alveolar sacs, which then connect with the pulmonary vein and artery, and that's the oxygen comes down through the bronchus, through the bronchioles, and then into the alveolar, which connects with the pulmonary artery and vein, which is then how the oxygen, the waste from the veins, from the cells. Remember, we did this in the cardiovascular system. The waste picks up, the vein carries the waste from all the different cells, and it is carried up to the lungs, where it connects with the alveolar sacs, right? And then we exchange waste product to be expired. And then taken in is the oxygen, which is then taken to the heart. And we start the whole thing all over again. Okay. So isn't this amazing how it seems so simple. Breathe in, breathe out. And yet all of that is going on in your lungs, and this handoff of waste products from the cells with oxygenated blood to the heart and then through the whole body to all of the different cells, every single cell. Okay. If you've ever run in really cold weather, you might find that your hands get numb. Or if for some reason you hyperventilate, or if you know someone that was having a massive asthma attack, okay? Anything that interrupts the intake of oxygen and the exchange for the carbon monoxide, okay? What will happen is the extremities will start to get numb. And the reason for that is not enough oxygen. So it's interesting, at least I find it interesting, how a breathing problem can affect your dexterity, your ability to feel and use your hands, which is the musculoskeletal system for the most part. But you already know that the oxygen is passing through the veins and the arteries, and all that stuff is all going on every minute of every day. If it doesn't, you're in big trouble. Okay? Does that make sense? All right, let's look at some diagnoses. Diagnoses, the explanation of why a patient needed the care of a healthcare professional. Okay, Rochelle is asking, do your fingers discolor from lack of oxygen? When they get to that point, yes, they will start to get a bluish tinge from a lack of oxygen. If that is the situation for too long a time, then the blue will actually turn to black, and that's a sign of necrosis. This is also one of the reasons why people with diabetes mellitus need to have their feet inspected by a physician, because their peripheral oxygen exchange can be interfered with. And that's why you may see someone with diabetes, uncontrolled diabetes, somebody who's not doing what they're supposed to do, most part, will suffer more often from amputations, whether it's a toe, a foot, or a leg. And the reason for that is that the oxygen is not processing through their body. Their circulatory system is not functioning and not bringing that oxygen to the peripheral extremities. Peripheral on the outside, right? Peripheral extremities, your hands and your feet. Okay, so that will be the first sign. So that's a good question. Bluish is what indicates a lack of oxygen anywhere in the body. But again, because your peripheral extremities, your hands and your feet, are farthest away from your lungs, they're going to be the first to show signs of not getting their fair share. Okay? Does that make sense? Okay. All right, so let's talk about some diagnoses. Remember, diagnoses explain why the patient required the care of a healthcare professional, also known as medical necessity. We need to be able to explain this because the health insurance companies, nobody's going to pay for a procedure or a service or a treatment that doesn't have a valid reason for being provided. So that's how diagnoses and procedures kind of marry up together, okay, by this standard of care. The standard of care says, when this is what's wrong, this is what you need to do. Okay, they learn that in doctoring school. All right, so the epiglottis, and the reason I want to show this to you especially is because you see the use of what you have been learning these last 2 months so far, which is your prefixes, your suffixes, and your roots, okay? And you'll notice that every one of these terms here in bold ends with the same 4 letters, and that is itis. I-T-I-S, which means anybody? Inflammation.
Inflammation.
Yes, thank you. Inflammation or infection. Okay. So now that you remember, itis means inflammation or infection, and now you look at the beginning of these terms and you'll notice every one of them is an anatomical site within the respiratory system that we just discussed, right? Epiglottitis, inflammation of what? The little flap that's on top of the trachea, right? Okay. Laryngitis, did you ever have like a sore throat and after a football game or a basketball game where you were okay. All right. Laryngitis, inflammation of the larynx. Now we get a complicated one, okay? Laryngotracheitis. What's that? Take it apart. Laryngo, the larynx, trachea, the trachea, itis, inflammation. So it looks like it has about 47 letters in it, but you now have the knowledge to take it apart and figure out what it means, what it's referring to. Nasopharyngitis. Remember, I told you the nasopharynx is where the nasal passage meets the pharynx down the back hallway. Okay. Nasopharyngitis. We have an inflammation at this point. Well, I can't really point to it. Okay. Pharyngitis, the pharynx. And rhinitis. Oh, rhino. Think of rhino. The big, huge animal with that big horn on the front. Okay. Well, that has the same Latin and Greek root as medical terminology. So when we refer to the nose, we refer to it as rhino. Rhinitis is an inflation of the nasal mucosa, which is a sign of a cold and many other things, but for the most part, a cold. Okay. If you ever know anybody who got a nose job, what is commonly known as a nose job, that would be rhino as your root, and then plasty, which is the medical suffix for repair. You see how these long terms can look so intimidating, but now you are learning what you need to be able to parse them apart and figure out exactly what is going on with this patient. Okay? All right. Now, sadly, babies can be born with congenital anomalies, congenital during gestation. Sometimes it doesn't cook right while it's in the oven. It happens. Okay. Now, this is different from genetics. Genetics means this was an anomaly or an abnormality in the genes. So that is inherited from mom, dad, or both. Okay. Congenital just means something went wrong in the cooking process during gestation. So there are babies who are born with respiratory distress and cyanosis. And that's what Rochelle was asking before. Remember when I said, yes, premature babies are known to get respiratory distress because the lungs are the last anatomical system that develop during gestation. So if a baby is born too soon, its lungs have not yet fully developed. Cyanosis is what we were talking about before, okay? And again, let's take your knowledge that you have. Cyan is the color blue, right? Cyan is the color blue. The suffix osis, O-S-I-S, means condition of. That means that the baby or anyone, okay, we talked about before that blue tinge, meaning there's a lack of proper oxygenation through the body. You don't want a blue baby. Well, maybe I guess in Avatar, they probably have a blue baby, but that's a different kind of blue. Okay. I hope you're laughing. All right. So, pulmonary hypoplasia is the fancy schmancy medical term for an infant whose lungs did not form completely or forms incomplete or improperly. So this might be a premature baby, but pulmonary hypoplasia does not require the baby to be premature. It just means something went wrong in the creation of this child's lungs. Okay. Sometimes it's fixable, sometimes not so much. Okay. And so this would be different than, for example, a child who has asthma, who develops asthma early in life, which often is a genetic thing passed on from parent to child. You see the difference? All right. Now, problems with the lungs can also be caused by other conditions. Did you have a question? Okay. By other conditions, which is not uncommon in the world of the human body, because as you are learning, and as you learned in anatomy and physiology, all the pieces parts work together. They may be independent systems, but as we were discussing, the respiratory system is, yes, I'm the respiratory system. I'm in charge of bringing oxygen into the body and getting rid of carbon monoxide. But I have to work well with the pulmonary vein and the pulmonary artery so that the oxygen that I bring in can then be shipped over to the heart and sent to the rest of the body as needed, and so that the veins that are bringing the carbon monoxide, the waste products, can expel them. Okay, so there's got to be this cooperation between the teams. Measles, which we hadn't seen. We've finally gotten rid of it until there were people who decided they didn't want to vaccinate. And there are lots of conditions that can arise from the condition of the measles, which includes obliterative bronchiolitis, a blocked movement of the bronchioles that makes it hard to breathe. Okay. By the way, if you didn't know, measles in a pregnant woman can also result in the baby being born deaf. I don't know the origin of what group went overseas. What I do know is when everybody was getting vaccinated before people started becoming against vaccinations, starting with COVID was kind of the first time. Well, okay, but no, I don't know. I don't know, and I'm never going to tell you something that I don't know for a fact. So I don't know. what I do know is if you're vaccinated against measles, you're not going to get measles, which means you can't carry measles no matter where you go. Okay. Next, left-sided heart failure is known to cause pulmonary edema, contain an excess amount of fluid in the lungs, pulmonary lungs, edema, swelling, remember, from too much fluid. It could happen in a cell. It could happen in a cell in your lungs. Okay, that's bad. That's not where we put the water. Okay, pleurisy, an inflammation of the parietal and visceral pleurae. Remember, the pleurae are the basically like the coverings around the lungs. Is usually a complication of, it could be pneumonia or lupus, trauma. I actually had a good friend many years ago die from pleurisy. So you don't want that. You don't want any of this. Okay. Oh, lifestyle behaviors. And you know what? I should have added vaping to this list. Now that we know that smoking cigars, cigarettes are known to cause respiratory disorders. And yes, I hate to say it, but vaping also causes dysfunction in the lungs. Okay. And again, I think that if you want to continue living a good life, you need to be able to breathe. It's just, and not have an elephant sitting on your chest, because that just becomes very difficult if you want to go play pickleball or basketball or go canoeing or kayaking or anything that requires any effort at all, like walking up a flight of stairs. Okay. And then the result from that can be a sedentary lifestyle. And, if you've seen anything anywhere, you already know all the lectures about how sedentary lifestyles is bad, 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 bad. Okay, but what can happen is that creates thrombi in the legs. Do you remember what thrombi are? We talked about that when we talked about the cardiovascular system. And so that's a blood clot attached that forms and attaches inside a vein or an artery. Okay. So that's kind of like you're driving home on the parkway and a car is broken down in the right lane. So now all the cars have to slow down and go around it. Okay. That's annoying when you're trying to get to work or you're trying to get home from work or you're trying to get to the movie theater or whatever. Okay. But my point is that when this is a broken down car inside your vein or artery, you have a problem because that's slowing down the passage of blood through your circulatory system, which means your delivery of oxygen is going to be late and picking up the garbage is going to be late. Who needs that stacked up inside your body? Ew. Okay. Then you have the added concern that a thrombus, remember, which is attached to the side of the vein or the artery, can break loose. Then it becomes an embolus, which is a blood clot that is freely traveling through the cardiovascular system. So what can happen then? Well, it could travel along. Oh, there's no room for me in the pulmonary vein. Oh, there's no room for me trying to go through the mitral valve inside the heart. Oh, blockage. Blockage? Blockage means no flow. No flow means no oxygen. Bad. All right, obviously, I'm trying to make this funny, but it is the opposite of funny. And if that embolus gets into your lungs, very, very painful. Very, very painful, and possibly death-causing, life-threatening. Okay? Embolus in the heart, life-threatening. Embolus in the brain, oh, that's what we call a stroke or a cardiovascular accident. So again, you see how we're talking about this here as we talk about the respiratory system, and still we're now back into the cardiovascular system. Yes, Rochelle is asking about the change in air quality that can affect your lungs. Yes, absolutely. Moving from one state to another depends on where you're moving. Yes, but the air quality in different states is quite different. Like if you're looking for nice clean air, I would stay away from East Palestine, no, it's Palestine, East Palestine, Ohio, where that train derailed and sent all those toxic fumes into the ground and the air. And when it went into the ground, it went also into the water. Okay. So, yes, absolutely. Absolutely. Even moving, for example, from New York City to upstate New York, dramatic difference in air quality. And now the EPA measures air quality in every city in the United States. So you actually can find a place. And then you want to also look at sea level, because sea level, the higher you go from sea level, like living in the mountains of Colorado, the air is thinner and it can make it more difficult to breathe because it puts different pressures on the lungs. You see, this is so complicated. Okay. All right, there's also trauma. And if you've watched any of the millions of healthcare oriented television shows like New Amsterdam or The Resident or Chicago Med, any of those, you are likely to see a patient come in the emergency room with a traumatic pneumothorax. Now, let's take that apart because you know you can. So traumatic means something happened to this patient. This was an impact from an external source. All right. Pneumo, lungs, thorax, chest. So essentially what a pneumothorax is that air has gotten through it. Let's look at the picture. Okay. You see the black line around the lungs? Okay. That's the pleura that encases the lungs. It keeps all the pieces parts together and protected. Okay, that's a good thing. Now, that's sitting inside of your chest. And of course, when you breathe in, your lungs expand. So they have to have room between the lungs and the pleura and the chest wall, your ribs, your chest, okay, your sternum. They have to have room to be able to expand to bring in the oxygen, right? But if air gets in this space between the lungs and the chest wall, it can't expand because the air is stopping it. So you've seen this on TV and in movies. So they take this big syringe or this needle without a plunger and they pam it into the patient's chest, and that releases the air, and now the patient can breathe because that pocket of air has been removed and there's now space to be able to intake air. Okay? That is a pneumothorax. Pneumo, air, thorax, chest cavity. Now, sometimes on these TV shows, you might hear about a hemothorax, and you're going to use what you're learning in this class to say hemo is blood, thorax, chest cavity, which means instead of air getting between the lungs and the chest wall, it's filling with blood. And the blood, again, will prevent the lungs from expanding, which means the patient cannot inhale properly and get the right amount of oxygen into the body. Okay? Does that make sense? All right. Makes sense to me. Now, when I was putting this slide together, it's kind of sad, and I read about volcanic dust and from an erupting volcano, and I thought, you know, we can't relate to this. We live in the United States, and right? What do we have in Hawaii? We had a volcano erupt, what, about a year ago? So, yes, and that stuff gets in the air. And that's what Rochelle was referring to, the air quality. So stuff gets into the air, you breathe it in, and it does all kinds of messy things in those little bronchioles and the aerial sacs. Man-made elements such as asbestos in buildings. Now, by now, they should have gotten all the asbestos out of the old buildings. And of course, they don't use it anymore. But I got to say, it's a good example and something to think about, because who knows what they're going to find causes whatever next. I don't know. All right. And last but not least, we got to consider that there are pathogens that travel through the air. And the whole Legionnaire's disease is a really good example, or a really bad example, however you want to put that, of pathogens traveling through the air. The whole thing with the Legion, why they call it the Legionnaire's disease, is there was an American Legion convention in a hotel, I want to say in Pennsylvania, but I won't swear to that. But and what happened is this bacteria, the bacillus, got into the air conditioning system. So everybody in the hotel started getting sick. And you know a little bit about airborne pathogens because we've all just been, I hope we're close to the end, but the whole thing with COVID-19 and needing to wear a mask, and that is for more closely transmitted bacteria or pathogens, because COVID is a virus, Legionnaire's disease is bacteria, fungi is another thing. You know, if you've ever known somebody who had mold in their house, or somebody who lived through Katrina in New Orleans, or actually now in California, and anywhere where there's flooding, you have the possibility of developing mold. And the mold, while you can see it on the wall or something, it gives off spores that you cannot see with your eyes. But your lungs certainly know about it because you're breathing that stuff in, and then it's doing all sorts of square dances and waltzes and all kinds of dancing in your bronchi and your bronchioles and your, nobody wants that, and that's not what it's made to do, to deal with. Okay? All right. So you see how everything, anywhere, everywhere can affect your respiratory system. And as we stated before, it's kind of hard to live without breathing. So I hope you've also seen how I've tried to show you how what you're learning, the prefixes, the roots, the suffixes, and connecting that with anatomical sites. So you can tell, oh, this is an itis, that's an inflammation, that's a diagnosis. Oh, this is an ectomy, that is a surgical removal of something, that's a procedure. And then we're getting you started on the right foot for whichever healthcare path you're taking. So most importantly, review, review, review often, because that's the way you're going to get your brain to hook onto it. Use that medical dictionary. It's not cheating, it's working smarter. And query me whenever you have any kind of question, or you're not sure, or you're maybe sure, or you think you're sure, but you're not sure, but I'm confused. Okay. And please, please, please make certain you use this email address and only this email address to get in touch with me, because the other one that says Shelley Safian at my CCTC, that goes into the rings of Saturn and I never get to see it. I don't have authorization. Safian SC, and I promise you a response within 24 hours. Girl Scout sponsor, right? I promise. Okay? All right. Go out there and breathe deeply and cleanly and have a great day. Have a great week, and I'll see you next time. Bye bye.